The Uganda Medical Association UMA is raising an alarm over what it describes as a collapsing healthcare system in the greater Ankole sub-region. During a regional advocacy tour, medical leaders uncovered alarming staffing gaps, with some facilities operating at just 33% capacity. Mbara Regional Referral Hospital, designed for a Uganda of the past, is struggling to serve today's population. UMA leadership, on a fact-finding mission, says the infrastructure is buckling under the weight of over 40 million Ugandans.
Most of the universities had between 9 to around 49% staffing. It means there are no adequate lecturers. So what we ask the government to lift the ban. You know, the indirectly they say there is no ban on recruitment. But if you steal my wage bill that you can't pay people, for example, if the hospital is given 2 billion that they cannot spend beyond 2 billion, that means you can't recruit.
The crisis isn't limited to infrastructure. In the greater Ankole sub-region, medical staff vacancies have reached a breaking point. UMA officials report that even the region's best-staffed hospitals are missing nearly 70% of required personnel.
In the private facilities, there's a bit more of improved services. For example, at the Divine Mercy, at the Doctor's Plaza, the facilities were a bit improved. There's quite some space. Of course, they also lack some of the necessary support. The space may not be enough. They have told us that they have bought land, they want to expand. They will need some affordable capital, and we call on government to support our doctors in this.
At Mbara University of Science and Technology, concerns are growing for the future. Professor Joseph Ngozi warns that a freeze on recruitment is creating a mentorship gap. As senior doctors retire without replacements, the next generation of medics is being left behind.
The numbers of medical doctors formerly employed in the healthcare system are still small. The doctor-to-patient ratio in this part of the country is still very wide, and there's a lot of burnout. It's not uncommon for medical doctors to face a challenge of burnout. They get tired, overworking for many hours.
Adding to the strain is a hostile political environment. Dr. Kabwere accused local politicians of harassing health workers over systemic issues like dirty words or medicine shortages that are actually caused by understaffing. Even private facilities like NeoCare, which offer specialized services like IVF, are stretched with only a few specialists serving the entire region. UMA's message to the government is clear: lift the recruitment ban and invest in equipment or risk total collapse of the region's healthcare system.
Specializations we have and the doctors we have are mainly in infertility and advanced surgery. We have embryologists, we have IVF doctors, we have IVF nurses, we have IVF lab persons, and we also have laparoscopic surgeons, 3 of us. Yeah, for the unit, we are okay, but for the region, we are very few.
As the budget cycle approaches, all eyes are on the Ministry of Health to see if the concerns of Greater Ankole will be met with more than just promises. The UMA is specifically advocating for a policy to station 2 doctors at every health center 3 to help decongest regional hospitals.